The gentleman yields back. The chair now recognizes Mr. Cárdenas for 5 minutes for questions.
Thank you, Chairman Guthrie, and also Ranking Member Eshoo for having this important hearing. And I appreciate the opportunity to discuss in front of the whole world, Secretary Becerra, what we are doing proactively in many areas. And I really appreciate the budget that the President has put forth. And I'm thrilled to see that the President has emphasized in his budget requests placed on funding for 988 and the broader continuum of crisis care in America. The 988 Suicide and Crisis Lifeline is saving lives by providing urgent and timely responses to individuals in crisis. It's a key starting point for the crisis continuum, but it's not enough to just have someone to call. When someone calls 988, we also need someone to come and somewhere to go when an individual requires greater mental health support. I'm particularly excited to see requests for robust funding for mobile crisis response grants so that trained mental health professionals can be the first responders to mental health emergencies. And I would hope that my colleagues who represent much of rural America are excited about the opportunity to have mobile crisis response grants put out in every corner of this country, especially in rural America. Secretary Becerra, maybe in your opinion, is it so critical to have a robust crisis care infrastructure in our country?
Congressman, thanks for the work that you have done over the years on this issue. The reason it's so important to have a crisis care system is because people don't have a mental health crisis just from the hours of 9 to 5. There has to be a place for them to go after hours. They have to know that when it hits, there'll be someone there to catch them. And a 24/7 crisis care center is the best way to make sure not only do we save lives, but keep people from harming themselves.
I want to make it clear, I think you and I are talking a little bit inside baseball. When you and I are talking about crisis care, we're talking about mental health crisis. Right now in America, or before last year, if there was a crisis moment in America, maybe somebody was off their meds and their mother called 911, who would show up? Maybe there would be a healthcare professional show up, but 99% of the time it was the law enforcement officer who, even they and we all agree, they are not trained to deal with mental health issues. We need mental health professionals to show up to the moment so that we can actually help the situation instead of unfortunately have a critical moment where it even gets worse. So when it comes to mental health in America, we are making improvements, and 988 is in fact a big step in the right direction. And hopefully Americans will take 988 for granted, like people expect that when they call 911, and it happens everywhere in the country, someone comes when they call 911, and that's what 988 is about. What resources are still needed to build out our crisis infrastructure when it comes to mental health and ensure that everyone, regardless of circumstance, can access crisis services, including the LGBTQ+ community and individuals and people with disabilities and those whose primary language is not English?
Congressman, on 988, I'll just mention we need to get states further invested in it because this is not a national program. Only because the President and Congress has been so willing to help the states have we been able to make it work so well. But if the states have to make commitments to have permanent, stable funding for 988 in their jurisdiction, and so that needs a lot of work. We're expanding access under 988 in languages other than English because we know a lot of folks need that communication. We are doing a call that's specific, a line that's specific for veterans. And so we're going to try to make sure we're approaching as many people as we can, including our LGBTQI+ community as well. Crisis care, we need to fund further crisis care so that it's available 24/7. We have to make sure that there is follow-up service when someone does reach out and make the call. And so we're working as hard as we can to make sure certified community behavioral health centers receive the support to be able to expand.
Locally in every community, correct?
That's correct.
Okay, so when somebody calls 988, they're not in California talking to somebody in 5 states over or what have you. Make it local, make it robust, and you're absolutely right. 911 is in fact a local funded program supported by the federal government, but it's primarily supported by locals.
By the workforce as well. We're working to expand the workforce because if there's a shortage in the healthcare workforce, it's even more acute in the mental health and substance use workforce.
Absolutely, and in order for us to have more mental health force workers ready and to fill those positions and do that work, we need to make sure that the local schools and the local activities are actually educating people so they can actually be in that position. My time having expired, thank you so much, Mr. Secretary. I yield back.
Thank you. The gentleman yields back. Chair now recognizes Mr. Griffith for 5 minutes for questions.
Thank you, Mr. Chairman. Thank you, Mr. Secretary.